What's going on, y'all? This is Lecrae, and listen, today we're gonna do something different. We're gonna do something that I think is necessary. There's a lot of perspective, a lot of speculation out there as far as COVID and the vaccine, and so today, partner with Ag Council and COVID Collaborative to talk with a medical professional about all things COVID and vaccines. We have an incredible guest with us today, Atlanta's own Dr. Vandy. Appreciate you. I'd love for you to share a little bit about yourself and let us know why you're way more qualified than me to talk about this.
Yeah. So thank you for having me. I mean, it's just great to be able to dialogue and talk about some of the topics that we're going to discuss. So my name is Vandy Gaffney. I'm a board certified fellowship trained anesthesiologist who also did health services and clinical research. And so I do this every day. I see patients every day. And I really mean every day when I'm working in the hospitals or clinics who have COVID-19, either active or previous infection. I'm in several hospital systems in the Atlanta area. And so this is something we, has now become second nature to us over the last 2 years, year and a half, basically. And so I have a lot of the same questions at the beginning as everyone else. And it's just an honor to be able to sit here and talk to you about how can we make our community safer by making the best choices with the most up-to-date and accurate information possible. Because there's so much disinformation out there. And I call it disinformation, meaning it's information designed to get you to make bad choices. And so, venues like this, avenues like this, where we can chop it up, and get down to the basics of what we need to know as a community are the number one way to fight that disinformation.
Well, I have a lot of questions. I'm gonna just be honest with you, because I live in a lot of different spaces, and I have a lot of friends with different perspectives and viewpoints. I'm a parent. I'm a part of the African American community. I travel quite often. I have friends and family who are vaccinated, friends and family who are not vaccinated, and I'm just like, man, there's so many perspectives going on out here that for me, I'm like, man, what in the world is going on, and how should we sit down and dialogue about this? And I know for me, I have a close friend, one of my friends who I did music with for years, and he passed away due to complications with COVID. And I mean, in his 30s, right? And so for me, I think that was a big eye-opening experience, and it made me realize like this is a lot more serious than I had considered it to be. And so I wanted to get answers, and I wanted to understand, what exactly we're dealing with. And so, just off the top, we've seen COVID come. We heard all kinds of political jargon. We've heard all kinds of rhetoric and different things about vaccines and variants. What, from your perspective, like, what do we need to do? We got Omicron and Deltas and Kappa Alpha Psi and Omega Psi Phi. I don't know what's going on. What should we be doing here? What's dangerous? What's not dangerous?
First and foremost, if you kind of had a innate sense that, all right, I probably shouldn't do that, you probably shouldn't do that. That's just one.
Okay.
So, and that might be your large gatherings without a mask, right? If you're going to be around a lot of people, this weekend right here in Atlanta is a Celebration Bowl. I'm from Orangeburg, South Carolina. All of Orangeburg, South Carolina is coming with South Carolina State and half of the state. Dion is bringing in Jackson State. It's going to be a lot of people. It's going to be a great celebration of HBCU culture and life and family. But we got to protect ourselves while we do it. So, wearing a mask when you're indoors with that many people, it's still important to wear a mask, even if you're fully vaccinated, because of that large number of people. And we can talk about some of those delineations. When you're outside, social distance as much as possible. You want to see your boys, your friends, your family. But, giving 3 feet is so much different. So the reason how they got to 6 feet was the path and the air travel of the air droplets. So if you're, 6 feet, they're saying, okay, if somebody coughs, typically that air droplet does not travel 6 feet. That's why it was 6 feet social distancing. If you can give 3 to 4 feet, but still hang out with your boy, Now you're protecting each other. If you wear a mask and I wear a mask, you know, one of the other things you can also do, commonly touched places, doorknobs, going in and out of a bathroom, in and out of the house, making sure they're periodically wiped down with disinfectant, keeping hand sanitizer. So, after you greet people, hand sanitize real quickly. So then that way you're always at a steady state of being protected. That's what you can do on a personal sense. The number one outside of that is being vaccinated. So that's always kind of an iffy thing for people, right? But if you went to public school in the United States, you had to be vaccinated. So you have had at some point in your lifetime to be introduced to, the immunization process to keep you safe from diseases. We kind of have a running joke in medicine. Remember that time you died from rubella? No, because you were vaccinated. And so, it's the same way. When we talk about the variants and kind of the disease itself, COVID is kind of this, unfortunately, mixture of a lot of bad things that can affect people. It is contagious. It does have a higher recovery rate. So we want to say that, 97% of people that get it, they recover. But we have some question marks with that, and I'll discuss in a moment. But it does cause, more morbidity, meaning people are sicker, longer, out of work, away from family. They don't have, when they recover, they don't have the same abilities and capabilities that they had prior to getting the virus. There's something called long haulers where you can have these symptoms, no taste, no smell, fatigue, brain fog, all of this for months. You have some people who don't really ever recover. And then unfortunately, you have those like your 30-year-old friend and like a family member of mine who passed away from COVID. And so it is serious, and so we must be vigilant in what we do, understand that there are some vulnerable people in our population. You mentioned being a dad. We talk about kids and the vaccine. And I know that's one of the, things we'll talk about, at what age and is it safe for your kids to be vaccinated? Yeah. The vulnerable of our population, we're going to probably see over the holidays. That's our grandparents, our elders, those are family members with chronic diseases. And so when we get together, it's real important that we know that we're all each other has. And so that just doesn't go, with, family and I'm going to, have your back for, finances and businesses, but it also should go for health. So That's what some of the things we can start with and do right now.
So, there's some questions that I have in terms of like, if you're vaccinated, can you still get COVID? And if you can get COVID, is it the same? All the different variants, a new one comes out all the time. Do we have to get vaccinated over and over again? How does that process work?
If you're vaccinated, and that means to be fully vaccinated, if you took Moderna or Pfizer, you had to have both of these series shots, and you're 4 weeks after the second shot, you considered fully vaccinated. If it's Johnson & Johnson, it's 4 weeks after their single shot. Yes, you can be introduced to the virus. So viruses are naturally occurring, organisms, they're everywhere, right? You can get introduced to the virus at any point. The purpose of being vaccinated is that when you get introduced to that virus, your exposure from the vaccine keeps the symptoms and the disease process low or non-existent. That's the whole purpose. It's risk mitigation, right? We wear a seatbelt because if I get into a car accident, the likelihood of me causing serious illness or death to myself is decreased if I'm wearing a seatbelt and if I drive the speed limit and if I'm not doing those things. That's what a vaccine does for, viruses and your immunology, your immune system in total. When it comes to the disease having COVID, the likelihood of it is decreased. For the variants, the most recent, the Omicron variant, that is seen to have what's called wide transmissibility. So people can get it, it's more contagious, but the symptoms have seemed to be less. So when it was first detected in South Africa and now more parts across the country and here in the United States, more world in the United States, the symptoms seem to be milder than the Delta variant. And what the variant is all these are just small mutations in the disease that change how it acts in community. So with Delta, it was highly contagious, but it was also highly virulent, meaning if you got it, you got pretty sick from it. That's why the concern, and it was a heightened concern from the medical community, because we saw that people got the Delta variant compared to the Alpha or the original was much more concerning. It was much more alarming. People were sicker. They got sicker faster, and the virus spread faster. Omicron, the virus actually spreads even a little faster, but symptoms are less. Mm-hmm. The same way, you fight them the same. Get vaccinated, social distance, mask, making sure you stay clean, you stay, your surfaces, your places of high traffic areas are always, sanitized and wiped down, keeping yourself from it. And so that's part of, understanding kind of the science about it, so you can make the most informed decisions for yourself.
I'm also curious, I got kids. I have a 10-year-old, right? And that's a tricky question. Sometimes I know parents are more likely to get the vaccine, but not want to take the risk of their kids. And, that's been a conversation in my house. And I'm just curious your perspective on like kids getting vaccinated. Is there, what would make us more comfortable even having that conversation or making a decision like that?
It's a good point. And so, I'm a dad as well. I have a 2-year-old going on 22. And actually, my second child was born on the 9th, so I'm not getting a whole lot of sleep these days. But it's an important question, and thank you for asking. So, just some of the science behind it. Pfizer looked at about 2,200 kids in that 5 to 11 age range, because you mentioned your child is 10, and the first study you ever do in anything with medicine in general, you do a safety study. Does this cause harm? And none of that was seen. Secondly, the second stage is, this doesn't cause harm, but does it actually help people? That stage was at 4,500 kids. So once we know, this is safe for kids, they doubled the number of kids and said, hey, does this work for kids? And then they gave it out to close to almost 9,000 kids. So in total, 18,000 students, a little bit around 15,000 kids across the country were part of these trials. And most of these children were children of doctors, research scientists, dentists, people who were in the medical community who understood, there's benefit here. And the way we show it is by getting our children vaccinated so that the greater population can see the benefit. So about a 91% success rate for kids from the ages of 5 to 11, and that goes up from 5 until adulthood. Because at first it was kids the age of 12, 18 to 12, and then it dropped to 5 to 11. So yes, it's safe. That's the number one thing we always want to keep as a parent, as a father. We keep our kids safe, right? That's goal number one, right? That's wake up in the morning, breathe, and that's the next job you have. So it's safe. When you think about wanting to do anything for your child, it's about getting the information and then also making sure that you explain it to your kid in a way that they understand. All right, I'm protecting myself, and once they understand that in a way, I think they'll be more active in the process. I'm fortunate. My better half is a pediatrician. And so she has this conversation with parents and kids all day. And she says the best way to approach it is give them autonomy, give them some stake in their own health. If you kind of say, hey, you're going to do this because it's so-and-so, you get some of that drawback. But if you ask them to, hey, look, do a little bit of research, go on your phone, look at what the CDC says, or, get them active in their own health, then they'll most likely draw the same conclusion, which is, hey, I want to be protected. I want to be safe.
So you got the double down doctor situation going on at your house. I see. Like y'all got a whole house full of PhDs. That's amazing. I'm curious about, like, because it's new. What are the long-term effects? Like, what could the long-term effects be for kids?
Sure. So one of the symptoms we see, this is a respiratory disease, right? So you're worrying about things like asthma, long-term. So when your lungs get stiff, it's called a restrictive disease. When you smoke too much, your lungs get really compliant. It's called a obstructive disease. So this is causing what we're looking more of like a restrictive disease, like the lungs get stiff when people with COVID-19, especially those who are smokers who have some type of lung history or condition prior to anyway. But it also affects all of your organ systems because it goes through your bloodstream. So the heart, your kidneys, your lungs, your liver, your endocrine system. Those are things that we are looking at that potentially cause morbidity. Here's the issue. No one knew back in the day when they were putting lead paint on houses that it was going to cause mental problems. No one knew asbestos was going to cause mesothelioma. So it's real important to protect yourself, not just from the disease process you can get today, but what that looks like in 30 years. Nobody knew going into the coal mines in Kentucky and West Virginia when to get those men and women black lung, 30 years later. And so what we're seeing now, because at the beginning, because everybody was so worried about COVID and we didn't understand it, it was brand new. What we're seeing now with autopsies of patients, and I know I don't want to get too morbid, but if you're looking at patients who passed away, their brain tissue looks like somebody who's 80 years old. Their lung tissue looks like somebody who's 80 years old. And that's what the virus can do to the body when you don't have any immunity. When you're not vaccinated and build that immunity, that's what it can cause. One thing we're not seeing with the vaccines, I can take you to a hospital right now, and the ICU unit is full of people unvaccinated with COVID. There is, unless you can tell me, you can hope with somebody, I can't find it. There's no hospital or no surgery center or no ICU full of vaccinated people with symptoms and side effects of the vaccine.
Wow.
And so the vaccine is working. And I'm not saying there are no side effects. I had a good friend, healthy dude, works out 5 days a week. He got the vaccine. 3 or 4 days later, he had a blood clot. And so it is not without risk. There's nothing without risk. But in his own house, and his significant other had COVID-19, he didn't get it because he was vaccinated. And so there's a risk reward, from this. And we really don't know what 20 years of COVID will look like. To answer your last point, I don't think we'll have to get, a new booster, every year, almost like the flu. The reason why the flu is that way is the flu changes so much from when the flu. So like there's an actual geographic map of kind of how the flu travels across the world. When it leaves Australia, kind of goes through Asia and Europe, it changes so much by the time it gets. So that's why the vaccine is different every year. Remember the H1N1, H1N3, those different variants of the flu and influenza are why we need a vaccine like that. We have not seen COVID, even though there are multiple variants, change in a way where it's thought that would be necessary. The reason for the booster is that over time, any immunity you build up kind of just over time, your body naturally reduces it. And so you get a booster shot to build back up that immunity, especially while the virus is so prevalent or so available in our communities. After, you keep hearing there's a term that this hasn't been talked about as much, but herd immunity. If we got to a certain level of vaccinations in the community, the prevalence of the virus will go away. That is still thought to be the case, but usually herd immunity is around 70%. Well, in the United States, we're close to almost about 65 to 70% fully vaccinated. So we're getting there slowly but surely. For this particular virus, it's going to probably need to be closer to 90 to 95% in order to reach that herd immunity where the prevalence of the virus is so low in the community, because even if the virus passes between me and you, we're both vaccinated, it doesn't cause us disease. So the virus ends up dying because our body's fighting it and it doesn't have another host to replicate.
So the booster then, I guess from what you're saying, is kind of vamping up or revamping the initial vaccine.
Is it? It's a recharge.
You recharge. Can you mix batteries? Can you mix
You can
boosters?
mix batteries. You can mix batteries. You can go from, if you had Moderna before, and actually there's research coming out that actually promote this. So if you had Moderna before, they're saying take Pfizer. If you had Pfizer, take Moderna. And that, because the mRNA technology, and I know a lot of people were kind of like, hey, what's this? But mRNA technology as general has been around for over 20 years. It's re-engineered a lot of cancer treatments. So the way we fight cancer in medicine, the way we fight a lot of chronic diseases have been invigorated from a success and a treatment standpoint because of mRNA technology. That's how they're able to apply it to this virus so quickly, because the old way of DNA vaccines would not have been safe for the community. But yes, you can, mix, suppliers of the vaccine, and is actually getting some research that is actually helping with kind of some of the cross-reactivity, meaning, helping to cover the original Alpha, Delta, and Omicron.
Let's say, I mean, it's holiday season. I know y'all excited about the holidays. It's holiday season. You got family coming in from out of town. Most of us missed Christmases and all that because of the quarantine and the whole nine. So people are trying to get back together over the holidays this year. Should family be getting tested? Do we gotta wear masks in the house? Like, what are your thoughts on all of that? Like, how should you interact with family coming in town?
I think you should get tested. So me and my family did this whole in Thanksgiving. We had a family member who unvaccinated, and they weren't ready to get vaccinated, and their children weren't vaccinated. And you don't ever want to isolate family. So you do what you do to protect yourself. So, after a conversation with her, she got tested. Everybody was negative. Y'all come on in, give me a hug. Everybody wear your mask. We're all good, So absolutely do you want to be able to get tested, because then you'll know if the disease is actually, present with you, right? So that gives people a peace of mind, like, all right, okay, now I'm on. If you're around a bunch of people who are unvaccinated and not tested, indoors, wear your mask, just wear your mask. Those are the things that are going to protect you.
Okay.
If you are, if you're going to a large gathering, we got, Medea House and it's 50 people and you just got to do it. Then make sure if you're not, you want to be vaccinated. If you're not vaccinated, you want to make sure you test and have as many people as possible who are willing to get a test. And you definitely have to wear your mask, because it's at that point where, the 15th person has grabbed a spoon for the stuffing and for, the sweet potato pie, where you might transmit the virus to somebody, and so that goes in also, we like grandma's china. She wants to pull it out and flex on everybody, because it's Christmas and it looks good. You might have to do paper plates. You might have, I went to a gathering, you got a cup with your name printed on the side. Remember you had when you was kids, your little red Solo cup. Don't lose your cup because you won't get it. You might have to do that again. So doing those things where you minimize transfer of items from one another that potentially can transmit the disease. So, small little things that you can do that'll add up to get you to that, that large effect.
Okay, so I know some people want to know this. I want to know it too. Like, when we're indoors and we're asked to wear masks, But then we sit down and eat. We take our masks off. What are we? Are we limiting? Are we putting ourselves in a? I mean, I don't know. What do we do? What's the thought process there? Is it?
So you got to live, right? So there's, we in science medicine, we understand there are limitations to everything. Nothing is 100%.
Okay.
So we got to eat. So you got to put a mask down. I haven't figured out or seen a mask that, I saw somebody cut a hole in the mask where they could put the spoon in, but you just destroyed the whole concept of the mask, but good luck. And so, so if you take it off to eat, there are places like, you fly a lot, travel, the the airlines are real sticklers on, they want you to take a bite and put your mask back up, kind of thing. I don't think we are there because people are getting vaccinated, because we know much more about this virus and how to treat it.
Right.
But yeah, if you're eating, go ahead and take your mask off. But if you're just, you out there in the living room, you playing spades or dominoes, if you, doing what you're doing with your folk, that's when you're indoors. That's when you want to be able to wear the mask. But, while you breaking bread, enjoying family at the table, just enjoy it.
This is insightful information here. This is stuff I hadn't thought of. I hadn't, gotten answers to. I have a couple more thoughts, and then I don't want to take up all your time because I mean, you giving us a college course right now and for free. But what about if I've already had COVID-19, do I still need the vaccine? Like, should I get the vaccine?
That's a very pertinent point. So, if you had the disease, you have what's called natural immunity, meaning your body fought it and it made its own antibodies. So the whole purpose of a vaccine when you get a virus is your body produces antibodies to fight that virus and any new introduction of that virus to your system. The way you need to figure out if you need to be vaccinated is by getting a simple, and I think it's very cheap, or even for most insurances or even most like community health centers, it's free, simple blood test. And it'll tell you what your your antibody production numbers are. So if your antibody production numbers are very high, the likelihood of you needing that vaccine right now is low. But if you had COVID at the beginning of 2020, and now it's the end of 2021, and you take that blood test and it's like 10%, 15%, you definitely need to get vaccinated. Eventually, all people who have had the virus for a natural immunity will need a booster. And so you're going to get to that point of needing that shot because that's like we talked about, naturally, the body's quantity of the immune system, it just goes down, for that particular antibody. And so getting that booster, getting that recharge is going to keep you protected.
This is my last question, a little controversial, but I'm just curious because I have some people who they're not about that vaccination life. Some people are all about the vaccination life. From your perspective, do you think it's necessary for everyone to get vaccinated?
Yeah, because you got to see what I see.
Okay.
I mean, when you see it's difficult because my perspective is different. When you see a 32-year-old on the phone in an ICU unit where nobody can come in, no family can visit them, crying because it's their 32nd birthday and they didn't take, the virus seriously and didn't get vaccinated. And then you got the mom outside, and this is real talk, like no cap. Mom is outside crying in the car because she can't get to her baby. And you see that, and you're like, what's the difference between that? Why can't mom and daughter be together? Well, they weren't vaccinated, and that's what caused them to have COVID. When you see mothers, as I mentioned, I just had a child a couple of days ago. When you see mothers who can't go to the ICU, the NICU, to visit their kids because they're not vaccinated, and you're not forced, but you have to understand everything we do has a consequence. And so if you're not protected, then you're at risk to yourself and you're at risk to others. And at some point, there's going to be a level of isolation, or you're just unable to participate in things that other people won't be able to. And on a personal level, it's all about health is wealth. One thing about our community, we, especially as Black men, we neglect our health sometimes way too much. And I'm talking to everyone out there and to myself. And so when we are able to focus on what matters, and meaning if we're healthy, we can take care of the family. When we're healthy, we can be those role models in our community. When we're healthy, we can be, the change we want to seek. But when we're not, it's kind of the old adage, when grandma and mom get sick, nobody happy in the house because they did everything. And so personally, being able to say, all right, I'm protected as much as possible so I can go out in the world, stake my claim, live my life, enjoy my family, my friends, the experiences that a holiday season, which is, this connectivity and these gatherings are sorely needed amongst our community. And we can do it in a way where there's a peace of mind is granted by personal protection of your health, then I think that just gets us that step closer to back to that just a little bit level of normalcy.
I appreciate you being candid and honest. Yeah, I mean, I can tell that you really care, and it means a lot. You care about the community, you care about people. I'm glad we got to have this conversation. I really do hope I never have to need you as an anesthesiologist in my life. But I'm grateful.
I got you.
Yeah, but I hope I don't need it. But I'm grateful, for this conversation. And man, I hope, people can benefit from it. A lot of times we're very opinionated, but we don't really get to hear from the experts and get to hear their perspectives. And so, man, I'm extremely grateful for you, and hopefully people can can receive this information and use it for their benefit.
And thank you for the opportunity, and thank you to you, man, you for using your platform, having just the humbleness and also the inquisitive nature to sit down and say, hey, there are things I don't know. I'm very good at this, and I want to learn more about this. And having that personality to say, hey, man, I want to not just learn for myself, because we could have had this over the phone, chopped it up, but you're blessing others by being a blessing and using your platform to get this information out there. And, the more we do that in all walks of life, the better we're all going to be.
Y'all, I mean, listen, there's 2 PhDs in this man's house. There are none in mine. So I learned something. Hopefully y'all all learned something as well. And listen, we're not going to get all our questions answered in 30 minutes or an hour. So if you have more questions or more inquisitive thoughts, make sure you go to getvaccineanswers.org. I know that is an opportunity for us to continue learning and to continue growing. So thank y'all for tuning in, and much love. God bless y'all.